I saw this article titled Rare Neurological Condition is an Important Potential Risk of Pfizer's RSV Vaccine. The rare neurological disorder that they're talking about is Guillain Barre Syndrome. I've taken care of a lot of people who have gotten Guillain Barre Syndrome from multiple vaccines, including the flu vaccine. So the RSV vaccine isn't the only one that's been associated with Guillain Barre Syndrome or GBS. The textbook patients, the people I used to read about in medical school with GBS, got it either after a viral illness infecting their GI tract or through vaccines. It's one of those times that the textbook cases ring true with reality. So what is Guillain-Barré syndrome? Guillain-Barré syndrome is an inflammatory polyneuropathy. That's a really fancy way of saying that with this syndrome, the nerves in the body get inflamed and therefore don't work properly. People with GBS first start feeling some numbness or weakness, usually in their feet, and then it kind of works its way up to the legs. Then the hands get involved and the arms. If GBS gets really bad, it can even impact someone's ability to breathe. Worst case scenario, someone can be so weak that they're essentially paralyzed and they need to be intubated in order to protect their breathing or even have the machines do the breathing for them. GBS is called an ascending paralysis because it starts at the bottom, the feet and hands, and works its way up. The reason it starts at the bottom is because the longer nerves tend to be a little more frail, and so the inflammation impacts those longer nerves first. So why is it that vaccines and viral illnesses are associated with Guillain-Barré syndrome? Because vaccines and viral illnesses can sometimes trigger an autoimmune response. In the case of somebody with GBS, this autoimmune response causes the body's own defenses to attack the nerves, which causes inflammation and damage to those nerves. Now, with that said, I've seen people make some amazing and full recoveries from GBS, in which they completely get their lives back. Between the treatments that we have, the incredible physical, occupational, and speech therapists that we have, people can often get stronger and do remarkably well. And just so that you know, the article did state that the US Food and Drug Administration has asked Pfizer to conduct a safety study for their vaccine.